Panchakarma is a treatment program for the body, mind and consciousness that cleanses and rejuvenates. It is based on Ayurvedic principles. Every human is unique phenomenon manifested through the 5 basic elements of ether, air, fire, water and earth. Combination of these elements are 3 dashas, Vata, Pitta, and Kapha, and their balance is unique to each individual. When this dashic balance is disturbed, it creates disorder resulting in disease. Panchakarma is done individually for each person with their specific constitution and specific disorder in mind, thus it requires close observation and supervision. Benefits of Panchakarma: eliminate toxins and toxic conditions from your body and mind. Restore your constitutional balance, improving health and wellness. Strengthen your immune system and become more resistant to illness. Reverse the negative effects of stress on your body and mind, thereby slowing the aging process. Bring about deep relaxation and a sense of well-being. Panchakarma is based on Ayurvedic principles. Ayurveda emphasizes preventative and healing therapies along with various methods of purification and rejuvenation. Ayurveda is more than a mere healing system, it is a science and an art of appropriate living that helps to achieve longevity. It can guide every individual in the proper choice of diet, living habits and exercise to restore balance in the body, mind and consciousness, thus preventing disease from gaining a foothold in the system. According to Ayurveda, every human being is a unique phenomenon of cosmic consciousness, manifested through the 5 basic elements: ether, air, fire, water and earth. Vata, a combination of ether and air; Pitta, a combination of fire and water; and Kapha, a combination of water and earth, are called the tridosha. These are the 3 humors or the 3 organizations of the body, which are also derived from consciousness. Each individual constitution or psychosomatic temperament is determined by the relative proportions of these 3 dasha at the time of fertilization. They are Vata, Pitta or Kapha predominant, Vata Pitta, Pitta, Kapha or Kapha Vata predominant and Vata Pitta Kapha in equal balance, a rare occurrence. Ayurvedic Tridosha. Understanding the imbalance of your unique body is the basis for treatment. Every individual constitution has its own unique balance of Vata, Pitta and Kapha according to its own nature. This balance of VPK is the natural order. When this dashic balance is disturbed, it creates imbalance, which is disorder. Health is order, disease is disorder. Within the body there is a constant interaction between order and disorder, thus once one understands the nature and structure of disorder, one can re-establish order. Ayurveda believes that order lies within disorder. Order is the state of health, as defined by Ayurveda. This exists when the digestive fire is in a balanced condition, the bodily humors, Vata, Pitta and Kapha, are in equilibrium. The 3 waste products, urine, feces and sweat, are produced and eliminated normally. The 7 bodily tissues, Rasa, Rakta, Mamsa, Meta, Asthi, Maja and Shukra/Ardava, are functioning normally. And the mind, senses and consciousness are working harmoniously together. When the balance of these systems is disturbed, the disease process begins. Purvakarma, pre-purification measures. Before the actual operation of purification begins, there is a need to prepare the body with prescribed methods to encourage it to let go of the toxins. These two procedures are Snehan and Svedana. Snehan is the oil massage. Oil is applied to the entire body with a particular type of massage that helps the toxins to move towards the gastrointestinal tract. Oil massage also makes the superficial and deep tissues soft and supple, thus helping to remove stress and nourish the nervous system. Snehan is given daily for 3 to 7 days, as indicated. Svedana is sudation or sweating and is given every day immediately following the Snehan. An herbal concoction may be added to the steam to further loosen the toxins from the individual. Svedana liquefies the toxins and increases the movement of toxins into the gastrointestinal tract. After 3 to 7 days of Snehan and Svedana, the doshas become well ripened. A particular Panchakarma method is then given according to the individual's constitution and disorder, prakriti and vikruti, respectively. 5 basic cleansing methods. When there is congestion in the lungs causing repeated attacks of bronchitis, colds, cough or asthma, the Ayurvedic treatment is therapeutic vomiting, vamana, to eliminate the cough causing the excess mucus. Oftentimes this also releases repressed emotions that have been held in the cough areas of the lungs and stomach along with the accumulated dosha. Once the mucus is released, the patient will feel instantly relieved. It is likely that congestion, wheezing and breathlessness will disappear and that the sinuses will become clear. Therapeutic vomiting is also indicated in chronic asthma, diabetes, chronic cold, lymphatic congestion, chronic indigestion and edema. Purgation therapy. When excess bile, pit, is secreted and accumulated in the gallbladder, liver and small intestine, it tends to result in rashes, skin inflammation, acne, chronic attacks of fever, biliary vomiting, nausea and jaundice. Ayurvedic literature suggests in these conditions the administration of therapeutic purgation or a therapeutic laxative. Purgatives help relieve the excess pit causing the bile disturbance in the body. Virekana cleanses blood toxins, the sweat glands, kidneys, stomach, small intestine, colon, liver, spleen, and Rakta Vahasrotas. Enema therapy. Vata is a very active principle in pathogenesis. If we can control Vata through the use of Basti, we have gone a long way in going to the root cause of the vast majority of diseases. Vata is the main etiological factor in the manifestation of diseases. It is the motive force behind the elimination and retention of feces, urine, bile and other excreta. Vata is mainly located in the large intestine. But bone tissue is also a site for Vata. Hence the medication administered rectally affects Asti Dhatu. The mucous membrane of the colon is related to the outer covering of the bones, which nourishes the bones. Nasal administration. The nose is the doorway to the brain and it is also the doorway to consciousness. The nasal administration of medication is called nausea. An excess of bodily humors accumulated in the sinus, throat, nose or head areas is eliminated by means of the nearest possible opening, the nose. Prana, life force as nerve energy, enters the body through the breath taken in through the nose. Prana is in the brain and maintains sensory and motor functions. Prana also governs mental activities, memory, concentration and intellectual activities. Deranged prana creates defective functioning of all these activities and produces headaches, convulsions, loss of memory and reduced sensory perception. Thus nasal administration, nausea, is indicated for prana disorders, sinus congestion, migraine headaches, convulsions and certain eye and ear problems. Traditional Ayurvedic method for purification and cleansing of the blood. Toxins present in the gastrointestinal tract are absorbed into the blood and circulated throughout the body. This condition is called toxemia, which is the basic cause of repeated infections, hypertension and certain other circulatory conditions. This includes repeated attacks of skin disorders such as urticaria, rashes, herpes, eczema, acne, scabies, leukoderma, chronic itching or hives. In such conditions, along with internal medication, elimination of the toxins and purification of the blood is necessary. Rakta moksha is also indicated for cases of enlarged liver, spleen and gout. Pit is produced from the disintegrated red blood cells in the liver. So pit and blood have a very close relationship. An increase in pitta may go into the blood causing toxicity, and thus many pitgenic disorders. Lifestyle and diet recommendations during Panchakarma therapy. During any step of Panchakarma therapy, traditional Ayurveda recommends certain lifestyle and diet guidelines. It is advised to get plenty of rest during the Panchakarma experience and to avoid strenuous exercise. Sexual activity, late nights, loud music, television and other such stimulating experiences. A mono diet of khichdi and ghee is recommended, as well as essential restrictions on cold drinks, cold food, caffeine, white sugar, recreational drugs or alcohol and dairy products, all substances which should not be resumed until sometime after Panchakarma is completed.